This week, Austin residents impacted by overdoses and homelessness held a town hall with officials as overdose cases are on the rise. KVUE's Maria Aguilera tells us some organizations are now pushing for a public health emergency to be declared.
Overdoses are on the rise. In Travis County, the medical examiner's office reported fatal overdoses were up from 107 in 2021 compared to 35 in 2020. That's why organizations in Austin want officials to declare a public health emergency.
Just the same way that when the COVID crisis happened, our government officials came together and they were able to declare something a public emergency to infuse funds into the community to get people tested and get people the things they needed. We're hoping to see the same thing around the overdose crisis.
Paulette Soltani with Texas Harm Reduction Alliance says a town hall was held on Tuesday with more than 100 people to address this.
We're in an emergency and the emergency is only getting worse. We invited our elected officials, some of our public health officials for Travis County and Austin to hear directly from community members impacted by the drug war and the overdose crisis, people impacted by homelessness.
Soltani says they need funding for immediate resources like Narcan, which is overdose reversal medication, and other harm reduction tools, funding for more outreach workers, treatment options, and housing for people who use drugs.
We need a different public health model in Austin and the county and really across the country. We can't keep dealing with drug use, with police and incarceration and criminalization. We actually have to treat this like a public health emergency.
Unless officials invest in resources needed to prevent more deaths, Soltani says we'll continue to see overdoses rise. In Austin, I'm Maria Aguilera.